So let's talk about what you specifically do, which is ketamine assisted therapy. Um, why ketamine? Why ketamine? You got your. We just talked about some really cool stuff: LSD, DMT, mushrooms, ibogaine. I
MDMA.
think is another one. All these cool ones to choose from, and it seems like I think the only one you're doing in your clinic right as of now is ketamine, correct?
Well, aside from the MDMA study, yeah, which is very limited because it's a clinical trial. But yeah, ketamine mainly because it's one of the very few, and I'll just say only, that's not completely accurate, but psychedelic medicines that we have available to us. It's a Schedule 3 substance, meaning that it's fairly easy to work with in a medical setting. Um, so that's one of the main reasons, and the other reason is there was research done many years ago that showed that it's very effective. You know, it first came to prominence as a treatment for treatment resistant depression. Um, you know, but to back up, ketamine has been around since the 1960s and is primarily used as an anesthetic.
Okay.
So, it's used in a lot of. One of the interesting things about ketamine is as an anesthetic. If you think about when you say go in the hospital, you have an operation or something like that. Um, if they anesthetize someone, they often need breathing support. You have to intubate someone or support their breathing artificially because just like heroin or other opiates, and one of the
Right.
reasons that people overdose is that it suppresses the respiratory system. People lose the ability to breathe on their own. So with ketamine, it doesn't suppress the respiratory system.
Ah.
So in the emergency room setting or in a surgical setting, you can give people very high doses of ketamine so that you can cut into them and perform various procedures without having to intubate them. So this makes it very useful also for pediatric procedures.
Ah.
And one of the things that people don't realize is it's very widely used in a lot of pediatric procedures. Um, it also has this horrible reputation as being a horse tranquilizer.
Yes.
Um, you know, Something that people should understand is that most of the medicines that are used in veterinary medicines are the exact same medicines that are used in humans. We are animals, we are mammals, and so some of the exact same medications, the same antibiotics, the same antidepressants that are used with animals.
Yeah.
So it's people get very hung up on that, like, oh, it's a horse tranquilizer. Well, no, and people should also understand horses for their size are very, very sensitive animals.
Ah, interesting.
So, you know, um, they're very sensitive to drugs. So, um, get back on track from that tangent. So, we discovered that ketamine was very useful as a treatment for this treatment-resistant depression, and that discovery was made at a time when we were all painfully aware that the medications that had been sold to us by the pharmaceutical industry, the SSRIs, Zoloft, Prozac, those drugs,
Yeah.
were minimally effective and, um, and often with a lot of side effects. People really don't like taking these medications. And psychiatry had kind of run out. There had been no new drug development for a very long time. Um, the SSRIs combined with what were called these atypical antipsychotics, which were supposed to be better than the old antipsychotics of the 1950s and 60s. Turns out, really not that much better, and also have side effects. And you know, people really don't like taking medications every day for the rest of their lives.
Yeah.
And so ketamine offered a very exciting alternative to that. And again, seems to be effective with, it's not something people take every day.
Right. And when they're coming in for treatment, is it like a micro dose, I'm assuming, of ketamine? Or, you're not
Yeah,
gonna knock them on their ass like a horse or something, right?
right, right. No, so we're absolutely working with the sub anesthetic dose, pretty far below what we would call the anesthetic dose. Um, but it's not necessarily a microdose either. People are At the lowest doses, people have described it as, sort of like having 2 to 3 glasses of wine. I don't necessarily, buy that analogy, but just to give, listeners kind of an idea at the lower dose range, it's a mild intoxicating effect.
Got
But
it.
people are still, present. They're still able to speak, to interact with the therapist in the room. But then at higher doses, what we would call kind of the psychedelic dose range, people do tend to be slightly anesthetized. I mean, they're at this point often having just a very deep inner experience.
Mm.
In a lot of the settings, people wear eye shades and headphones listening to music to really support that process of going inward.
Yeah.
So you're kind of blocking out all the external input, and that encourages people to go inward. So at higher dose ranges, yeah, people can have a pretty profound psychedelic experience.
That's awesome.